Assalamualaikum and salam sejahtera to everyone. I'm Dr. Zaleha Md Nor, Head of Patient Safety Unit, Ministry of Health Malaysia. First of all, on behalf of the organizer, we welcome and thank you to all of you that attending this webinar today. So, I will presenting an overview of the patient safety program in Malaysia, where we believe patient safety is everybody's business. This is the content of my presentation today. I will start with introduction and then patient safety and magnitude of unsafe care, some statistic from our surveillance system, the concept of accident or incident causation, the improvement, patient safety key strategies, and also the last but not least, the take-home messages. First, do no harm. It's a main principle of medicine. The objective is to ensure the benefit of treatment that we give is outweigh the risk of the treatment itself. So it is essential to deliver safe healthcare services to our patient. To us as healthcare professionals, improving patient safety is ethical and moral responsibility to patients and their families. It is also economic investment to our healthcare systems. What is actually patient safety? Patient safety is an absence of preventable harm to a patient during the process of healthcare and the reduction of risk of unnecessary harm associated with healthcare to an acceptable minimum. This is the definition from World Health Organization. So not only no harm to patient, but also our commitment to reduce the risk as low as we can. Basically, what we need to do is to prevent any harm to occur to our patient. We need to reduce the risk of unnecessary harm to a minimum as we can. And we need to take action in preventing harm as well as to reduce the risk of the harm. Now, let me see the burden of patient harm. First, patient harm is the 14th leading cause of the global disease burden. This is comparable to tuberculosis and also malaria. And 134 million of adverse events due to unsafe service happen in low-middle income countries every year. And in high-income countries, as many as 1 in 10 patients are harmed while receiving hospital care. And also the cost of safety failures far exceed the cost of prevention. Approximately 15% of hospital expenditure and activity in OECD countries is attributed to safety failures. And it also will cause a medical legal cost. In Malaysia, Ministry of Health medical legal cost of litigation and ex gratia is between RM 7.3 to RM 24.5 million per year. This is data from 2014 to 2019. This is the outcome of patient harm. For example, patient was admitted for lung infection, which is the initial illness or the main complaint. However, during admission, patient was given wrong medication and developed reaction. This is cause an additional illness due to patient harm to the patient. So this is where the incident happened. Because of the incident happened, patient need to be treated for two illness, which is the initial illness and the additional illness, which is lung infection and also the drug reaction. This will cause morbidity and suffering of the patient and also will require an extra cost for the treatment. Here we can see the cost to ensure patient safety far exceeded the cost due to system failure. What we need to invest is good equipment, safe environment, and also training to the healthcare providers to ensure our patient receives safe care. In contrary, if incident happen, cost due to system failure is bigger. The harm is heavier. The harm in terms of morbidity to the patient, even it can cause death, additional disease or injury to our patient, and also the additional treatment costs. It can also causing medical legal implications. We can conclude here if patient safety investment is value for our money. These are examples of patient harm in which we are also monitored in our surveillance system, such as medication error, wrong transfusion, wrong surgery, retained foreign body after surgery, patient fall in healthcare, healthcare-associated infection, healthcare-associated pressure ulcer, wrong diagnosis, delay in diagnosis, and also error or delay in treatment. As everyone already aware, 17th September every year is World Patient Safety Day. And this year, the slogan of our World Patient Safety Day is Medication Without Harm, which is in line with the third Global Patient Safety Challenge. The third WHO Global Patient Safety Challenge, Medication Without Harm, was launched in March 2017 at the Global Ministerial Summit on Patient Safety in Bonn, Germany. The objective is to reduce the level of severe, avoidable harm related to medication by 50% over 5 years globally. This is the strategic framework of the Global Patient Safety Challenge. It consists of 4 domains. The first domain is patient and the public. Where we want to inform and empower them to play their part in making the process of medication safer. And the second domain is regarding the healthcare professional. So we want the healthcare professional to prescribe and administer medicine in ways and circumstances that reduce the risk of harm to patient. And another domain is the domain of the medicine itself. Sometimes some medication is so complex and can be puzzling in their names or packaging. And sometimes there's lack of sufficient or clear information. And sometimes they're also confusing, which is like look-alike, sound-like medicine names, and or labeling or packaging are frequently a source of the error itself. And another domain is the system and practice of the medication. So in this challenge, we want to design a system that is more resilient to risk and harm. So there are 3 key areas in which in the framework we need to be emphasized, especially during polypharmacy, during high-risk situation, and also during transition of care. Here I will share with you some statistics from our surveillance system regarding patient harm and also medication error. This is some data from Malaysian Patient Safety Goals Performance for year 2021, in which we recorded 2 cases for wrong surgery, 51 cases for unintended retained foreign body, 35 cases of transfusion error, 2,583 cases of actual medication error, and also 4,234 cases patient falls in adults, and 464 cases of pediatric patient fall. This is the data from Incident Reporting System for Government Hospital and Institution for the year of 2018 until 2020. These are the top 5 incidents happened to our patient according to age group. As we can see here, medication error, which is in red, is the top incident happening to all the age group of our patient. These are some details for incident of medication error for 2018 to 2020. The total incident of medication error reported were 8,470 cases. Out of this, 59% were near miss and 41% of it were actual incidents. Actual incident here refers to incident where the harm is already received by the patient. If we see the outcome of patient following medication error, mostly are none or no harm, which is 82% from the incident. And however, for severe outcome, is 1% and less than 1% for outcome of death, which is 13 cases for the year 2018 to 2020. For the type of medication error, the most error is prescribing error, which is 4,164 case for the 3 years report, and followed by dispensing error and administration error. Here, we plot the medication error type with the patient outcome. So as we can see here, for the death and severe outcome, almost half of the contributing error is from administration error, in which 50% for death outcome and 48% for severe outcome, followed by prescribing error, which is 31% for death and 33% for severe outcome. Let me see what the concept of patient safety. This is the famous Swiss cheese model. It is a model of accident causation developed by Dante Orlandella and Jerry Zern. In this model, each slice of cheese represents a series of barriers in organization's defense against failure. The hole in the cheese represent the weakness of the system or an opportunity for failures. So failure or incident can happen when the hole in each slice of cheese align together, which permitting accident opportunity to happen. So the hazard will pass through holes in all of the slice, leading to an accident that can cause patient harm. This hole or the weakness that we can see here may be due to the staff shortages or inexperienced team members, or due to fail to monitor vital sign, or maybe could due to poor team communication. So we can say here accident happen due to multiple failures in the system itself. So what is the causes of patient harm? Causes of patient harm usually are complex and dynamic. It usually involves two levels, which is the superficial factor and also the deeper factor, or we call it the root cause of the incident. So usually it's a system issue, which is all the causes is reside in the structures, could be in the process, or could be in the delivery points of all level of healthcare system. So what is the causes of any incident? Incident or patient harm is actually like an iceberg. We can see it only the tip of the iceberg. Actually, there is still a big chunk of the iceberg below the sea that we didn't see. There is a superficial factors and also deeper factor or the root cause of the incidents. For the superficial factor, it can be due to unsafe act or unsafe condition. For deeper factors, usually it is due to the system failure. Usually when we do a root cause analysis, we are trying to identify where are the failures occur in the system. Why incident occur? Here I give an example of unsafe act. This is an incident where medication administered to wrong patient. So why it happened? Because the staff nurse did not practice to identifier. So we ask again, why it happened? So it happened because of no training given to each staff nurse, only to the new staff nurse. So we can see here there is unsafe act because the staff nurse did not practice to identifier, this is the superficial cause, but the deeper cause or the root cause of it because of the work and care environment where the nurses didn't given a retraining after some times. And here I'll give you another example for unsafe condition. So a patient fell while walking. This is the incident. So we ask why it happened. Yeah, it happened due to the floor was slippery without any signage. So we ask again why it happened to know what is the root cause of the incident. And then because no policy on putting signage, its floor is slippery and lack of monitoring. So we can see here the superficial factors is due to unsafe condition, and the deeper factor or the root cause is because of the management or the organization itself. These are some examples of unsafe act, which is not practicing hand hygiene, not practicing two identifiers, poor documentation, chartology without checking, ineffective communication within the teams, or not using any PPE. These are some examples of unsafe condition in the ward, such as slippery floor, high bed, which is risk for patient fall, multiple use of electrical power source, which can cause electric shock, crowded ward, broken hinges of windows, which can risk of patient fall from the height, no labeling, and look-alike medication that can cause for medication error. In root cause analysis, rather than punitive action to the staff involved, we try to identify the failure in the system because we believe patient is harmed due to system failure, not because one individual. These are the contributing factors to the system failure. It could be in the management or in the organization itself, in which lack of leadership or lack in governance, when the policy and standard is not available, there is a constraint of resource, or the safety culture and priorities were not practiced among the organization. So it could also be due to team factor, such as poor communication and poor teamwork, lack of supervision in the team, or lack of leadership and responsibility by the leader of the team, or also due to the inadequate support by the staff in the team. Other than that, it could be due to the work or care environment factor, such as a building or design which is not conducive to the patient, the physical environment which is not suitable for the patient, which is too hot or too cold, equipment malfunction, or staffing, which is commonly we see understaffing, or education or lack of training to the staff, and also heavy workload to the staff. So it could be due to the individual or the staff factor, which is the competency of the staff itself, or the fatigue, stress, or lapse in concentration from the staff, or maybe the staff has domestic issues, or the staff and patient relationship that is not very good. And also incident can happen due to task or technology factor. It could be due to the inavailability of information, or the inavailability of the equipment itself, or could be due to LASA, for medication error, which is a look-alike, sound-alike medication. And the contributing, other than that, it could be due to patient factor, which is patient had a comorbidity, and maybe the patient have multiple disease, or because the diagnosis itself is difficult to get, because of the physical factor of the patient or the personality of the patient itself. So how are we going to improve this? To prevent patient harm, we need to improve our patient safety culture. These are four components from individual action to collective action that we can practice daily. First, the safety thinking must be in the mind in everyone, and then safe practice in everything we do. Third, we have to ensure the safe condition or environment. And last, we need to have a system improvement to improve our service to our patients. So, what is safety thinking actually? Who need this safety thinking? This safety thinking actually is for everybody. That's why we said that patient safety is everybody business. And then when we have to have this safety thinking, so the answer is every time, because whenever we want to do a procedure or anything, we have to think, it is safe to do it. Is it the correct way? And then ask, am I capable to do it? Do I have a skill? And if I don't have the skill, should I get the help? So how can I do to make it safer? And what can I do to improve? This is the most of the question that we have to think before we do something to the patient. And what is safe practice? To ensure safe practice, we have to have the knowledge of the things. So when we have the knowledge, we need to be competent and have the skill to do all the procedures. So other than that, we have to follow the policy, guideline, and SOP. We need to have an effective communication and a very good teamwork. So one, I would emphasize, don't try to be a hero. If uncertain or need guidance, seek help. So we need to ensure our workplace is always in safe condition or environment. We can see here in the picture, the first picture is a very clean, good environment, and another picture is a congested ward, which is not very safe environment. Which one you think is safer? Of course, the first one, right? But however, we need to try to improve it to reduce the risk as minimal as we can. So here I emphasize again for system improvement. Try to improve up to we know what are the contributing factor or the root cause of the incident. It could be from these six contributing factors. Either it's from the management or organization factor, or from the team factor, or from the work or care environment factor. It could be from the individual staff factor, or could be from the task or technology factor, and also could be from the patient factor. Now I will go to the patient safety programs in Malaysia. These are patient safety program key strategies. First, start with organizational structure to make sure the program runs smoothly in each level. There should be policies and guidelines to help and give guidance to the implementers. We need a good monitoring system to monitor the trend and to see where are we, or to identify which area need to be concentrate. And there should be also a specific program to each specific problems. And promotion and education to staff and also patient regarding safety culture. We also need to have research to identifying other problems, and also we have to have a collaboration and networking with multiple agencies in tackling patient safety problems. These are organizational structures for patient safety program from national level to facility levels. This is the organizational structure of patient safety program. We have here in national level, which is Malaysian Patient Safety Council, and Patient Safety Unit in Medical Care Quality Section act as the technical secretariat. in this national level, we have an update on Global Patient Safety Challenge and issue on patient safety from Global or WHO, and we also give feedback on the implementation of the all of our patient safety programs to WHO. For state level, we have the State Patient Safety Committee, and in the facilities, we have the Facility Patient Safety Committee. This is the function of the Malaysian Patient Safety Council in national level. It is to advise the Honourable Health Minister on national patient safety policies, strategies and action plan. It also needs to enhance the implementation of patient safety strategies, to monitor and evaluate achievement of the Malaysian patient safety goals and take action at national level, and also to promote and facilitate national, regional and international collaboration in patient safety. Malaysian Patient Safety Council was developed after the directive from Malaysian Cabinet on 29th January 2003. In the council, the chairman is the Director General of Health Malaysia, and Patient Safety Unit act as technical secretariat of the council. Actually, it have currently the total members is 39, which is we have 4 appointed members, 20 representatives from Ministry of Health, which is consists to each of the programs and head of service. There are 3 representatives from Ministry of Higher Education, which is from UKM, USM and UM. Also 1 representative from Ministry of Defence. Also have 10 representatives from private sectors and NGOs such as MSQH, APHM, and 1 representative from Patient for Patient Safety Malaysia. Policies and guidelines is important to ensure the program is running as it needs to be. To date, we have 12 policy perkeliling or surat arahan regarding patient safety in Malaysia. All these policies regarding patient safety can be downloaded at our Patient Safety Council of Malaysia official website. One of the most important circular is the circular of Director General of Health number 1 2020, in which it stated that patient safety as a main agenda in healthcare service. This circular effective from 1st April 2020, which the scope including the public and the private sectors. The aim of this circular is to inform about the necessity of making patient safety as their main agenda in healthcare service in Malaysia. This is consistent with the 72nd World Assembly 2019 for the resolution of global action on patient safety. This is also can be downloaded from our official website, which is Patient Safety Council Malaysia website. These are the guidelines for patient safety program. Actually, we just launched our guideline on the management of unintended retained surgical item or URSI last week. We just launched our Malaysian Patient Safety Goals 2.0 last year, and the previous year we launched the Quick Guide Preventing Prescription Error. All these guidelines also can be downloaded from our official Patient Safety Council website. Yeah? In a patient safety program, we have 2 main surveillance system, which is to monitor the patient safety situation in Malaysia. The first one is the Malaysian patient safety goals. This is where the key priority areas and benchmarking of the patient safety program. It is to stimulate healthcare organizations to improve patient safety key areas as well as patient safety in general. It is also to outline the important patient safety area that need to be focused and improved. It also will provide a measurable bird's eye view or dashboard of the status for patient safety in public as well as private healthcare facilities in Malaysia. So there is performance measurement tool or KPI in area that we know that is critical to a safe healthcare system, and objective means for Patient Safety Council Malaysia to monitor and evaluate as well as improve the status of patient safety in the country. Last year in 2021, we just launched our Malaysian Patient Safety Goals 2.0 or MPSG 2.0, in which we reduced the number of the goals and also the KPI. For hospital, from 13 goals to 7 goals, and for clinics, remain the same, 4 goals. From 20 KPI for hospital to 9 KPI, and 6 KPI for clinics to 4 KPI in clinics. These new goals were developed based on the feedbacks from the stakeholder and experience that had been gained from 7 years implementation of the MPSG, the initial MPSG. So this MPSG 2.0 will be fully implemented this year, in which the performance will be presented in Malaysian Patient Safety Council next year. Here are the simplified version of Malaysian Patient Safety Goals 2.0. There is 7 goals. The first goal is infection prevention and control that have 2 KPI, which is the first KPI for hand hygiene compliance rate that we target for more than 75%. And the KPI for number 2 in goals number 1 is the rate of catheter associated bloodstream infection or CAPC, where we target for less than 0.5 per 100 admission. The second goal is for safe surgery, safe life. And then there is 2 KPI in safe surgery, safe life goals. The first KPI is a number of wrong surgery performed, where we target for 0 cases. And the second KPI in goals number 2 is number of unintended routine surgery item or URSI, where we also target 0 cases for category 2 and 3. For goals number 3, it is a medication safety. There is 1 KPI, which is number of medication error that lead to severe harm or death, and the target is also 0 case. For the goals number 4 is the transfusion safety. The KPI is the number of incorrect blood component transfused, and the target is also 0 cases. This is the goal number 5, which is fall prevention. The KPI is the rate of patient fall, where the target for inpatient is less than 5 per 1,000 patient days, and for outpatient and primary healthcare facilities, the target is less than 5% from the attendance. For the goals number 6 is the patient identification. The key performance index is the number of patient safety incident caused by wrong patient identification, which is detected by the incident reporting and investigation in the facilities. So this is also our target is 0 cases, and our last goal is incident report and learning system, in which the KPI is the implementation of patient safety incident report and learning system. The target is we need the facilities to have the system implemented in their facilities or system. So what is actually incident reporting and learning system? So incident reporting and learning system is actually a system of reporting any patient safety incident that occur in the healthcare or in the facilities. So they have to investigate or review why the incident happened. Then from that, they have to learn from the incident. They have to take appropriate action so that it can prevent the similar incident from happening again in their facilities, and they should also share it with other facilities so that the incident will not happen in other facilities also. So for our Ministry of Health hospital and institution, we have this incident reporting and learning system 2.0, which is launched in 2018. This new incident reporting and learning system is via online, which is open concept. It includes all actual and near miss patient safety incidents. So if any they can report anything incident that happened to the to patients. And this system also is simpler, more user friendly, which reduce the need to write narrative text, which is mainly you have to fill in the blanks and tick the box, and it requires less time to complete. It's also shorter process because it is online system where when the incident is reported in the system, the state level and the national level can directly see the incident. In patient safety program, there is also specific program to tackle specific problems. One of it is the Safe Surgery, Safe Life program, which is established in 2009, and Patient Safety Unit as Technical Secretariat for National Safe Surgery, Safe Life Steering Committee, which to ensure the Safe Surgery, Safe Life program is running smoothly. And this SSSL steering committee members are handpicked from crucial services that involve in the implementation of the program. The members include surgeons, anesthesiologists, and OT nurses. So we also had established SSSL committee at state and also facility level to enhance the implementation of the programs. And then we have this second edition SSSL guideline, which was introduced in 2018 with new checklist. Other than that, we have also patients for patient safety, in which this patient for patient safety or PFPS is a global network of patients, providers, policymakers, and those who have been affected by patient safety incidents, in which they are dedicated to improving healthcare safety through advocacy, collaboration, and partnership. This patient for patient safety was established in 2013, and the current president is Mr. Jemanwe, in which after my talk, he will give the talk for medication error in the view of patient. So this patient safety unit together with MPSG plays a role as an advisor for PFPSM and involved in the establishment or training of PFPSM with the WHO. Patient Safety Malaysia is governed under MPSG and also Patient Safety Council Malaysia. We also have PFPS Project Implementation Guide, which this guideline is to guide the PSPFM in implement their projects. It is also essential to have a promotion and educate our staff and also patient regarding safety culture. One of the way is by the World Patient Safety Day. During the 72nd World Health Assembly in 2019, they announced that 17 September as every year as the World Patient Safety Day. So each year they will give their own theme or slogan, and for the first year in 2019 the slogan was "Speak Up for Patient Safety." And in 2020 it was "Speak Up for Health Worker Safety." In 2021, "Act Now for Safe and Respectful Childbirth." And this year in 2022, the slogan is "Medication Without Harm," which is aligned with the third Global Patient Safety Challenge. And also during this World Patient Safety Day, they also light up iconic monument to show the solidarity towards patient safety. So during this World Patient Safety Day, most of the facilities or state JKN level will have World Patient Safety Day at their own facilities in which they promote regarding the patient safety towards patient and also to the healthcare workers. Other than that, we also have a mandatory patient safety course for house officer. It's actually intended for the house officer during their orientation program, in which to give them an overview about important areas which is related to patient safety. In these curriculums, they have 7 topics. First is what is the patient safety or the basic concept of patient safety. The second is safe surgery. Third, effective communication to improve patient safety. 4, infection prevention and control. Number 5, antimicrobial resistance. 6, medication safety. And last, regarding the incident reporting and learning from error. So after they completed this course during their orientation program, they have to sit for exam, and we in patient safety unit will monitor the progress. This is to ensure that the housemen, before they go into practice, they already have the basic knowledge regarding patient safety. So there are also multiple training conducted to the patient safety officers, to the quality managers in the state level and also in the facility levels, such as incident reporting and RCA training. And we also have the, like today, the webinar during the World Patient Safety Day, and also seminar conducted by the state level and facility levels during World Patient Safety Day. And last, this is the take-home messages, which is simple mistake can be lethal. So patient safety is not an option but mandatory to everybody. Make it everybody business. Remember our safety equation for healthcare professional? Everything starts with your mind. First, safety thinking that can lead to safe practice and to ensure a safe environment and always practice system improvement. So with that, I thank you.